Welcome back to another live with us at Alps. It's another Wednesday with your fertility specialist, and you are highly welcome. Thank you for always liking our posts, sharing, and commenting. We really appreciate. Um, my name is Nashed Miracle, and I'll be your host for today. And in the house, we are going to, on set, we are going to be talking about a very important topic, which is hormones and its impact on infertility or on fertility, rather. So stay tuned, stay glued to your screen so you will learn today, because a lot of people have different narrative on what hormone is and what it does to the body. So today we're going to talk deeply about that. And the person that will be sharing her knowledge with us today is a consultant gynecologist, Dr. Jane. Thank you, ma. You're welcome.
Thank you for having me today.
You're welcome.
Okay.
All right. So today, like I earlier said, we're going to talk about hormones and how it impacts infertility. So most times people used to just think that hormone is just about what makes period, especially in women's, and they'll just think that okay, this hormone is just something that makes me have period. That's like the basic knowledge that people have about it. So today, thank God you're here. You're going to help us like break it down so that my audience will understand what it is. So you can start by telling us what hormones are.
Well, hormones are basically chemical substances that are produced in the body
Okay.
by special glands. By glands, I mean they're like special factories in the body
Mm,
responsible for production of hormones. And
okay.
these chemicals are actually transported to different parts of the body.
Body.
Like in summary, I would say that these hormones are responsible, they are crucial for body's function. So they tell the body what to do,
Okay.
when to do it,
Mm-hmm.
and how to go about it.
Okay. So having known what hormone is, can you tell us how it impacts, like, why is it crucial in like reproductive health or in
Yes,
reproduction?
well, their hormones are actually crucial. They are integral in reproductive function for both women and men.
Mm.
And I would say hormones are more like they act like control rooms for reproduction, so
Okay.
that too little can affect reproduction, too much of it can affect reproduction. So most of the time we talk about balance in your
The
hormones. So
hormones.
it's a very integral part from different parts of the body. We have those produced from the brain,
Mm.
from our reproductive organs, and all of these work together
Okay.
to come up with reproductive function, from preparing the body for pregnancy, carrying pregnancy, sperm production, menstruation, ovulation, and all of those functions in the body of the
Okay.
woman and
Mm.
the man.
That's nice. So this is like you telling me about hormones in male and female now, because you mentioned sperm production. So can you list some of these hormones that are important? Yes, they are important in male and female.
Well, a whole lot of hormones are essential in reproductive function for women and men. So for the women, we have what we call the gonadotropins releasing hormones. Well, these are big names, but
Yeah.
they are produced is produced from the brain.
Okay.
And this brain also signals another part of the brain called the pituitary to produce what we call luteinizing hormone and follicle stimulating hormone.
Hormone.
Well, these are also big names. Commonly, you hear people say FSH and LH. The FSH basically helps the growth of eggs. LH helps with the release of eggs. So you can say egg grower, egg
And egg
releaser.
release.
Yes. Then we also have prolactin,
Okay.
which is also produced in the body and can also affect ovulation, menstruation, and all of that.
Wow.
Then we also have thyroid hormones produced from small glands. We've talked about glands being like
Glands.
small factories on the neck
Yes.
and that can affect the body function, activities of the body generally. Yeah, so those are important hormones. Then we talk about estrogen, progesterone.
Mm.
In women, estrogen basically helps also prepare the lining of the womb and tells the brain to increase luteinizing hormones so that eggs can be released.
No.
Progesterone helps like stabilize the lining of the womb, makes the like stabilizes the lining of the womb and makes the baby, if pregnancy happens, to be
To
able to
maintain.
implant to
Okay.
maintain the pregnancy.
Okay.
While for the men, just like how for the women, we also have the gonadotropin releasing hormones.
In men as
Yes,
well.
it helps to kickstart the process. We
Okay.
also have follicle stimulating FSH. Yes, when you say follicle, it looks like it's a feminine thing, but
Yes.
they also have a role to play for the men. And finally, most importantly, is testosterone that is
Okay.
responsible for the functions of production of sperm quality, um, productivity, and function, and even also helps with the volume of semen that the men produce. Of course, even in men, you can have thyroid hormones when low or too much of it can also affect reproduction in
Mm.
men too.
That's nice. So I think that my audience, not all of them will know that the LH, which is the luteinizing hormone, and the follicle stimulating hormones, like, okay, no, the luteinizing hormones, men have that. Not
Yes.
everybody knows that. I think the basic one is the testosterone. Everybody just thinks that, okay, that's like the only hormone. So I think since we're doing two parts now, I want us to go into the female proper. So you can tell us what how this hormone coordinates, like the menstrual cycle and ovulation in women. Let's start with in women.
Okay, basically, we had started with the listing of the hormones. So, in coordination of the menstrual cycle, I mentioned the gonadotropin releasing
Releasing
hormones in the
hormone.
brain.
Yes.
So, the gonadotropins basically are the FSH and LH, and these hormones are very important. So, FSH is when the woman starts her period for on the first day of the woman's period. From that time, this hormone is produced gradually,
Mm.
and with that, it helps with the maturity and growth of the
Of the
eggs
eggs.
until we have what we call the dominant follicle, or what we call the winner egg, that is
Okay.
released at the
That's like
end.
the one egg.
Yes, so we
Okay.
have a lot that mature, a lot of
Mm-hmm.
follicles, but only one egg is released at the end, at the time of ovulation.
Yes.
Then we also have while this is going on, estrogen, these follicles also produce estrogen,
Okay.
and estrogen helps improve the lining of the womb, and it helps with the growth of the lining of the womb, and also signals the brain to increase the LH, what we call the LH surge. And that is the point where the luteinizing hormone comes in. And luteinizing hormone helps with the release of eggs, which is called ovulation. And
Ovulation.
ovulation is only when women ovulate, per se, those that looking at spontaneous pregnancy,
Yes.
that you can get pregnant. So then after that egg is released, the the pouch where the egg is released from, what we call the corpus luteum, is formed, and that produces progesterone that helps prepare the bed for the baby to sit. So it goes, you have FSH and LH controlling, then the estrogen and progesterone also coming in at
Yeah.
different points, growth of egg, release of eggs,
Mm-hmm.
preparing for pregnancy. And when pregnancy doesn't happen, progesterone, these hormones drop, and it's that fall in the level of the hormones that leads to the menstruation, and
Okay.
the next cycle continues, and that's how it goes.
So you talk about estrogen and ovulation. I mean, yes, estrogen and progesterone in ovulation and everything. So you mean that that's like part of the menstrual, you know, coordination, the hormones coordinating the menstruation.
Yes.
Right.
So as it goes, so when you have a graph, they work simultaneously.
Mm.
So as your FSH is rising, estrogen is also rising and building the bed. So by the time you get to almost middle of the cycle, we have rise of LH, and once you have the ovulation, progesterone starts at that point starts to rise. So it's almost everything works together. It's this for description. It seems like they are
Yeah.
different parts of the menstrual cycle, but it's a unit
Okay.
working in a coordinated manner to bring about menstruation, ovulation, and maybe pregnancy.
So
That's the way.
wow. So you did justice to explaining what luteinizing hormone does, follicle stimulating hormone does, and progesterone and estrogen. So how does this cause infertility, like the hormones, the LH, the FSH, and the progesterone and estrogen now.
Well, basically, now we have talked about, most importantly, we talk about balance when we are
Mm-hmm.
discussing hormones.
Yes,
Too little, too
too
much
much.
can affect um, fertility.
Yeah,
So we had mentioned that the FSH help with the growth of follicles. It means that when we have reduced the follicle stimulating hormone is inadequate or not enough, you might not have the follicles to grow to
grow.
maturity.
Mm.
And when you don't have follicles growing to maturity, you might not have a good lining for implantation if pregnancy events. So it means you don't have follicles, the lining they are not growing. Then when you have too much of luteinizing hormones, like we commonly see in women with polycystic ovary syndrome, that gives an environment where we have a lot of male hormones, androgens kind of, so they don't ovulate because in polycystic ovaries, the hormones, follicle stimulation might be low,
Yeah,
and you don't have maturity. And when you even get to the middle of the cycles, because of the LH luteinizing hormone
it's
forming the poor
plenty.
quality of eggs and all
Mm.
of that, you don't have release of egg. So if you have what we call imbalance in this hormone, so balance is key when we talk about fertility and hormones. Balance is key. So when we have a balance, we can have the reproductive process would easily go on. But once we have an imbalance, either too little or too much, this can affect. Um, then also progesterone. When it's too
Estrogen.
little again, you might have issues with maintaining pregnancy, recurrent miscarriages, and all of that.
Wow. So same with progesterone.
Yes,
What
it's
does how
progesterone.
does it
Okay.
work?
Progesterone, we
Yes,
had said progesterone helps in maintaining the
the pregnancy.
pregnancy if
Yes.
it occurs in the earliest phase until the placenta takes over. So when we have people that have low progesterone, you know, it's difficult for them to maintain pregnancy. So we have failed pregnancies, recurrent miscarriages, early miscarriages, and
So
all of
that will
that.
have to get to the point where there's already fertilization and all of
Yes,
that
yes.
before it will have like an
Yeah,
effect.
so that's why I say they work in a coordinated manner. If you have a problem in one, so if you have FSH, LH coming and all of that, everything goes well. Reduced estrogen, maybe from the air quality not producing or from anything that could affect that,
Okay.
can lead to difficulty, or the pregnancy might not. It might not be reduced progesterone. The pregnancy might have challenges with staying in there,
Okay.
or you might have uncorrect miscarriage because of
Okay.
the progesterone maintains the pregnancy and also reduces some kind of activity, like kind of subtle contractions that go on
Mm.
within the uterus.
Wow. So we talked about the hormone and like the major hormones in females. So um the women, like there are some women that will tell you that I'm seeing my period a little too early or it's late, and then they, because we have this thing that will say, oh, maybe it's just stress, I've been overworked last week, so maybe it's stress that is causing that. So can you tell us like one some of the causes of like this hormonal imbalance now?
Well, commonly you see people with polycystic ovary syndrome, they can have hormonal imbalances. Then some medical conditions can lead to hormonal imbalance.
Mm.
Then people that have problems with their thyroid gland, you can have hyperactive thyroid or hyperactive thyroid. All of those can lead to hormonal imbalance and can affect product. Then people that are even excessively stressed out
Mm.
can lead to, who have chronic stress, acute stress. All of those can affect the balance in the hormones, and lifestyle also plays a
Okay.
role.
Well,
Lifestyle plays a role in hormones and their balance, and all of those can affect pregnancy, conception, fertility, sperm production, and all of that in both males and females.
wow. So the lifestyle map, please can you just brief us on some of the lifestyle that causes the imbalance?
Well, lifestyle. So now we look at smoking and alcohol
Mm-hmm.
can affect the quality of your eggs, quality of the sperm. Poor sleep can lead to increase in production of what we call cortisol, which are stress hormones. And stress hormones can affect the release of what we call gonadotropin releasing hormones. And once this is not produced, you don't have your gonadotropins, FSH and LH. This can affect then if you overweight or underweight.
Mm.
So when you're overweight, You might have too much of production of estrogens, too much of LH, luteinizing hormones we give the male environment and all of that. Then underweight too, you might not have your estrogens are not produced, so you
Mm,
cannot even signal the eggs and production. So it just has a way of going round and round the cycle. So balance is key. Again, we
okay.
emphasize in this discourse.
All right, thank you, ma. So now that we've listed the major hormones in the females, I want us to go into the male section. So you can just tell us the hormones that are important for male fertility or like sperm production and all of that.
Well, for male fertility, again, same thing for the women. We have the gonadotropin inducing hormones. We have mentioned FSH, LH. All these are starters to the production of sperm production. Then we have testosterone. Testosterone is the major contributor to the production of sperm, and of course, you know that is key in male fertility.
Yeah.
Then we also have those that have problems, thyroid hormone issues.
Same with the male.
Yes, yes. So
Okay.
thyroid hormones actually, I don't know, for lack of better word, maintains the metabolic function or the activities in the body of individuals. So
Okay.
once you have too little activity or too much of it, it has a way of affecting also sperm production and quantity. And basically, well, to a little extent, some might have what we call prolactin, but that is not a very common feature that you see in male reproduction. But
Okay.
the ones I've listed would
Okay.
suffice.
So the testosterone now, we're talking about it since it's like the major one. How does it really affect or how does it impact the fertility?
Well, testosterone basically, it helps with the production of um it affects quality of the testosterone. So
Yes.
when you have too little, too much now. So we have normal testosterone. We're going to be looking at good quality,
Mm-hmm.
quantity. Then also, it also affects the volume of the semen. Semen is produced from prostate gland and other parts of the male reproductive organs. It helps with all those would play a significant role in testosterone, basically. Then testosterone, not just that production, it also help with the libido for the men to have sexual
Oh,
drive, good erection, and a whole lot. So, while it plays a role in the functionality and production of the sperm cells
yes.
function and all, it also helps with the male characteristics because, of course, to also have good erection and also the libido and all of that.
So what does luteinizing hormone has to do with the male?
Well, basically, all of those, listeners and FSC, basically, they are all called, they are starters in the production. So they are all
Okay.
they are smaller units in the production of sperm. So all those are incorporated in that production. Yeah.
Okay. So what happens if a man's hormones is imbalanced? Does it even happen? I don't know.
Yes, it does happen. Just
Okay,
like
there are
we
hormones
have.
who get disrupted just like the
Yes, so
women.
medical
Yes.
conditions can affect. Even men can have excess of testosterone. We talk of balance again. Excess
Mm-hmm.
testosterone, men that take anabolic, what we call steroids, and all of that to induce
Yes.
their masculinity. That can affect when you have too much of it. Can also affect production quality and all of that. So anything that can make a man, even stress, can affect the quality and quantity of their sperm cells. So, and all of those, once you have reduction in anything, can lead to stress, can lead to reduction in an imbalance
In
in
the
their
hormones.
testosterone and all of that.
Okay. So if a client comes now, because if a client comes and let's say it's a woman and she comes and she lay her complaint to you, what usually is the best test to run to see if her hormones are not balanced or they are balanced?
Well, basically, to evaluate a woman that is trying to conceive for whatever reason or having challenges with her menstruation, whichever way, most importantly, you need to take a good history. By the time you evaluate, you want to know what the problem is and how to go about it. So, but to have their basic hormones, just like I've listed, all these
Yes.
hormones can be analyzed in the laboratory. And if a woman's story, so it depends on what she tells you,
Yes.
you know what you look out for. So you can analyze the female hormones just I've listed. You can analyze the follicle stimulating hormone, the FSH, LH, want to look at their semen quality. So once you have challenge, once you notice there are issues with that, you can actually assay this thing. You can also analyze whether you can analyze their follicle stimulating hormone
Hormones.
LH, just like you do
LH.
for the women, and sometimes even testosterone.
Okay. You mentioned prolactin earlier, but I think I skipped that totally. So I don't know if you can explain to us what prolactin does to the body normally and how it causes infertility.
Well, prolactin in when prolactin is high, when you have what we call hyperprolactinemia, it can affect a woman's period.
Okay.
So it can cause irregular period. It can also affect ovulation. And
Hmm.
okay, and for some women can also have this breast milk discharge, which might or breast discharge that might not be comfortable, they might not be comfortable with. So prolactin commonly is a hormone that is high when women are breastfeeding. So a woman that is not breastfeeding, she has breast nipple discharge or breast discharge. You want to find out other things and assay or analyze prolactin to find
Okay.
out if it's
So
too much.
yeah, so a young girl can just come in and she'll be having discharge, like breast discharge.
Yes, yes.
Mm.
So it can be analyzed because there's a range too. There are also sometimes you can have breast discharge, not just sometimes too some women can have you can have a tumor in the brain or a growth in the brain
Mm.
that can exaggerate the prolactin in the body. All of these can be and the history, and that's why it's important to interact with the client. What they tell you determine your next line or what you will do and how you look at or evaluate them even further.
Okay. So are there some medications that, or treatment, let me call it treatment, are there some treatment you can do for this hormonal imbalance and all, in male or in female, like both of them? I want to know both.
Well, basically, when you have imbalance, you want to find out the cause of the imbalance.
Mm.
So when you know the cause, you treat the cause because in treating the cause, you are almost trying to stabilize the problem. So to say you are giving a drug, probably you are just treating a condition, but not necessarily like when you have high prolactin, there are drugs you
Yes.
can take.
Mm.
So you treat the cause of the problem, and that automatically balances out what the problem is. So, of course, there are other things you can do for those trying to conceive and all of that.
Yes.
Yes, like if you are not ovulating at all. But most importantly, if it's stress, you want to take out stressors, lifestyle, you want to modify lifestyle, excessive weight gain, you want to reduce weight, reduce refined fats, carbohydrates, and all of that. So you work according to the needs of the clients as they
Mm.
come.
Okay. So I think you've done justice to the topic hormones and its impact on fertility. So after knowing what hormones are in male and in female, and what how we can get them, like how we will know if it's high or not, and who can have this and who can, not have. So do you have any extra thing you want to tell my audience about hormones and its impact on fertility?
Well, not so much. Just a closing statement where
Okay.
I'll say hormones are crucial for reproduction, and for reproduction to occur, balance is key. It's not too much, not too low. And of course, there are a lot of things that can affect, like we talked about, stress and
Yeah.
lifestyle can affect the balance in your hormone. But again, the good news is that for whatever the situation is, there's a solution. And for every form of imbalance, once we identify the cause and offer appropriate treatment, oftentimes patients do better and their imbalances are corrected.
So is it safe to say that young girls should, or everybody, to the females now, should they constantly like try to check, their breast to see if there's something coming out of it, like the discharge you talked about, the prolactin? Because I think it seems to be very common these days.
Well, once in a while, it's natural for people to tend to feel their body parts and all of that. So if a woman feels like she's having breast milk discharge, why not? She should be analyzed. But frequently, sometimes too, excessive nipple stimulation can give a false rise in
Oh.
your. So That is why when they come with those complaints and you see a high value without discharge, sometimes you want to take a history, find out the activities the person had before presentation to the facility.
Okay.
Yeah, so it's okay to feel your body parts and also understand what is going on. So it's not it's fine. You see something a growth or a swelling or something that you don't understand. It's fine for people to do that.
Okay. So we've learned a lot today about hormones and what they do to the body. And thank you so much for staying with us to learn this topic today. Thank you, Ma, for coming. We really appreciate your presence here.
Thank you very much for
Thank you.
having me.
So thank you guys for staying with us to the end of our live today. Thank you. You can continue sharing, liking with your friends, your families, and everyone around so that they can learn also. But if you feel like you need more of this explanation, you can come to us at Alps and we'll give you everything that you need. Thank you so much.
All right. Thank you for having me.